Welcome to the Sleepy Cypress Clinic's Televisit Protocol and Practice Guidelines, presented by your favorite nurse practitioner, Lauren Westlaw. Today we're going to talk about a new and exciting initiative to our clinic. I will give an introduction and overview about telehealth, specifically how we are going to start offering televisits to our patients. We will be reviewing the basics, why we have chosen to do this, and how we are going to implement this into our practice, as well as our timeline for rollout. So what exactly is a televisit? Well, telehealth utilizes technology communication systems in the assessment and management of patients. There are many facets to how telehealth can be utilized to aid and assist patients, but we're going to start offering the televisits in our practice. A televisit falls under the umbrella of telehealth. Televisits involve a patient and a healthcare provider using real-time audio and video technology to deliver care, such as this picture on the right, where you can see that they're using an iPad to schedule a visit between a patient and a healthcare provider. This can also be done on a telephone with the appropriate technology capabilities. You may be asking yourself, well, why do we need to do televisits? Well, we've identified a need in our community to provide increased access to care. We know that making an appointment isn't always the most convenient for our patients. Heck, sometimes it's not even convenient for us. You have to make the appointment, you have to schedule time off of work, secure transportation, and sometimes line up childcare. Offering televisits will make access to our services much easier for our patients, increase our continuity of care, and improve appointment compliance. Additionally, with the previous year's events of COVID-19, we as a clinic felt the need to start utilizing technology more. We need to ensure that we can connect with our patients even when they physically can't come in and see us. So how will this help us? Offering televisits will help us to have a greater focus on chronic disease management, improve our efficiency, increase satisfaction, and provide higher quality of care. Part of the quadruple aim defined by the Institute of Healthcare Improvement is to optimize health system performance by improving population health, lowering costs, and providing patient experiences. We hope to use these new benefits to provide follow-up visits with patients, assess new medication efficacy, and discuss lab results, provide symptom triage, and to help to obtain and maintain a strong patient-clinician relationship, all to hit each of these aims and, most importantly, take better care of our patients. While televisits may have many benefits, we appreciate that there are going to be some barriers, both known and unknown. We fully anticipate that issues will arise, and we have looked to other clinics to find barriers that they had. Some of those identified barriers were internet connectivity issues, particularly with bad weather, concerns over security, privacy, and confidentiality, billing and reimbursement issues. To combat some of those potential barriers, we have worked to minimize the issues that we can. We have secured fast internet access, partnered with a telehealth system that has a superior rating system for both delivery, ease of workflow, and even assists with billing. Since this is going to be a new initiative for all of us, we have developed some guidelines that we would like everybody to pay attention to. Televisit appointments may not be made for any patient complaint of chest pain or difficulty breathing. These patients need to be referred to either emergency services or to contact 911. To have a televisit appointment made, patients must have access to an electronic device with a camera, an internet connection, and have an active email address. Appointments are not confirmed until the patient receives confirmation email at the email address provided, and the confirmation email will include instructions and a link to access their appointment. Discussion of any questionable appointments with the provider prior to making the appointment. If in doubt, talk it out. If you're not sure if they qualify to have a televisit, please talk to a provider first before scheduling. Televisit appointments will need to be booked for a time frame of 15 or 25 minutes and are only to be scheduled during the hours of 7 a.m. to 9 a.m. and 12 p.m. to 1 p.m. There are some strict rules that we will be enforcing, and these will also be included in the email that the patient receives, but we would like them to be reviewed as well before the televisit after they make the appointment. The rules are that they have to have identification with the picture must be shown during the visit, no recording of the televisit by audio or video, no taking photos during the visit, sexual misconduct of any kind will not be tolerated, adherence to a dress code outlined in the confirmation email, and any aggressive, threatening, or foul language will not be tolerated. In combination with our guidelines, we have also set forth a protocol for our televisits. For scheduling, we need to make sure that we are identifying appropriate appointments. When appointments are made, please review proper appointment standards, how appointments will be confirmed, accessed, and conducted, set expectations for use, and notify of identification requirements. For the actual appointment, be aware of all practice guidelines, comply with all confidentiality requirements, and conduct visit with the door closed. Log on with only your credentials. Please introduce yourself, establish patient name, date of birth, contact information, confirm and update any known allergies, and identify the main purpose of the visit. Conduct your assessment, discuss your diagnosis, treatment plan, and follow-up care if needed, thank the patient, and end the visit. Then complete appropriate documentation and submit to billing. While we do hope to get this up and rolling rather quickly, we have created 3 phases to implementation. Our first phase is our patience, practice, and flexibility phase. We appreciate that this will be a learning curve for all of us, but we can do this. We have purchased 2 iPads and 2 computers that have been set up with webcams in the private offices for quiet and confidential assessments. Robust training will be conducted with all staff on the proper use, confidentiality, and etiquette practices. Prior to going live, we will conduct practice sessions in which we will run scenarios from appointments making through the actual appointment to familiarize ourselves with the process and equipment. Of course, lunch will be provided. This brings us to the exciting Phase 2 implementation. We go live on October 15th. Don't be nervous, we've totally got this. We will support and help each other all along the way. Please be sure to familiarize yourself with our guidelines and protocol, as well as the regulations for use of telehealth. You can find the guidelines here located at the link. And if you have any additional questions, please feel free to contact myself or the office manager. We've also included some information on the HIPAA compliance guidelines as it pertains to telehealth initiatives. Please familiarize yourself with those as well. We'll then roll into Phase 3, our evaluation phase. We are going to conduct this 1 month after going live. We want to assess how well the televisit process is going. We will be conducting patient surveys, a staff and clinician survey, and we will be asking for staff to complete an anonymous lessons learned worksheet. All of these are to better our process to ensure the process from start to finish is smooth and satisfactory for everyone. If there are any immediate issues, questions, or concerns, please feel free to bring them to the clinic manager so that we may address them immediately. Thank you so much for all that you do for our patients every day. This truly is the dream team. In summary, we are implementing televisits in our clinics, both to help create a better continuity of care for our patients, improve population health, lower costs, increase our patient satisfaction, and improve the overall patient experience. Please, if you have any questions or comments, feel free to come to me at any time with them or address them directly with the manager. We hope that this goes smoothly. We do anticipate a few bumps in the road, but we can do this together. Thank you so much for your time.